The government legislation that has passed as of the 1st of November essentially means that we're able to deliver all of these services far more accessibly to women across the country, and that really is a massive opportunity to create change, both on an individual and an economic level for women's health. I'm Dr. Sneha Wadhwani. I'm a GP in Bondi in Sydney. I'm a Conjoint Lecturer at the UNSW School of Medicine. I'm a GP Registrar Trainer and a Clinical Director in the ForHealth Group of medical practices across Australia for New South Wales and ACT. I'm Head of GP Wellbeing at ForHealth, and I'm also the co-founder and Clinical Director at Evoca Women's Health. There's been an incredible uplift in the funding for women's health across bulk billing and also across increasing rebates for certain services provided in the women's health space. This has included things like menopause health assessments and also extra funding for long-acting reversible contraceptives as well. Now, while these are extremely important services for contraception, they have an incredibly important role in managing certain conditions such as endometriosis, pelvic pain, heavy menstrual bleeding, and also as a part of menopausal hormonal therapy. So they're really critical in this space, and this funding and investment essentially means that more women are going to be able to access these services at little or no cost nationwide. So it really is a game changer there for us as GPs and also for patients who need that care. Historically, it's been challenging for GPs to deliver comprehensive women's health care in the GP space. Time constraints and lack of funding have been limiting factors here, and especially when you think about an extensive menopause health assessment, which can often take upwards of 20 or 30 minutes, alongside contraceptive services such as IUDs and contraceptive implants. The rebates for those services made it a difficult procedure to deliver for many practitioners, because of the overheads in terms of equipment needed, the time needed for those consultations, and the training and skills needed to get to that point to be able to deliver those services often made it not cost effective for them. And so the investment here really opens the opportunity for GPs to deliver that care in a better way, and for patients, the access is just opening quite considerably in that space. So I think more GPs will be able to come to the table. The government has promised also that they will be working with the RACGP and the family planning organisations to deliver free training for IUD and contraceptive implant services, which further mean that GPs are going to be able to skill up more quickly and deliver this service in their clinics as well. The Evoca model is based around GP-led women's health care. All the GPs that work in the Evoca space are skilled and trained to deliver comprehensive, holistic and evidence-based women's health care. We work alongside allied health partners and nurses who equally have that passion and extra skill in the women's health space to really provide that holistic care for women through all their life's journey across all the challenges and all the hormonal and reproductive health changes that happen along the way. We opened our first clinic in December 2022, and we actually have 43 of them now nationally. And it's expected with these changes, in fact we know that 28 of those are actually going to convert to bulk billing the services we talked about in the women's health space across the nation, and we expect that 75% will actually go to fully bulk billing in the next 12 months. So this opportunity from a funding and incentives perspective has really allowed us to deliver that comprehensive comprehensive women's healthcare far more accessibly and to more women. 50% of the population are women, and really we know that chronic diseases, health problems across the female population essentially affect not only the individual at home and in the workplace, but also their families and communities. So the effects of not addressing women's health are really far-reaching. I think the call to action for clinicians listening today is really to embrace the new incentives and the opportunities that these bring. I think there is a tremendous opportunity here to diversify. If you're a GP who's interested in women's health, then there's certainly an opportunity to upskill and develop in that space and provide those services comprehensively to women who need this care and have been delaying that. We know that 1 in 10 Australians delay care or forego that GP appointment because of cost. And we know women are disproportionately affected by that. We also know that 40% of pregnancies in Australia are actually unplanned. The government legislation that has passed as of the 1st of November essentially means that we're able to deliver all of these services far more accessibly to women across the country. And that really is a massive opportunity to create change, both on an individual and an economic level for women's health.